Okay, so now we take a look at the issues in the psychological and substance use disorders chapter. So just to go through some of the conditions, first we start with generalized anxiety disorder. This is a condition in which the person is worried or nervous about many or most things in life. So this is an individual who has difficulty controlling worry. So they constantly worry about things. There is specific criteria for diagnosing generalized anxiety disorder. So to actually have the disorder, you basically have to have 3 or more anxiety symptoms. They have to be symptoms that impair social, academic, occupational, or relational functioning. So they have to actually have a major impact in some part of life, and it has to be excessive daily anxiety for about 6 months. So all of those things kind of coupled together would be part of your diagnostic criteria for being diagnosed with this condition. Panic attacks are extreme attacks or episodes that seem to come out of nowhere, and usually they're in response to an accumulation of stressors. So the individual who would start to suffer from panic attacks is usually somebody who's involved in a lot of stressful situations over time, and the attacks can be stimulated by an acutely stressful event. So if the person continues to experience stress over a prolonged period of time, and then there's a certain event or situation that kind of sets off the actual panic attack, and physical symptoms can become apparent with this. So if you remember what we talked about in class in regards to these conditions, that some of the things can actually start to affect physical health and start to create physical symptoms. So symptoms such as chest pain or shortness of breath are often present. So many times these individuals actually feel like they're suffering an actual heart attack, when in reality it's the panic attack causing the chest pain and discomfort. Post-traumatic stress reactions, so these fall under the category as well with the other anxiety disorders of post-traumatic stress reactions. So there's a couple things that could fall underneath this category: acute stress disorder and post-traumatic stress disorder. So these are conditions, these are caused by reactions in response to exposure to a life-threatening event or other situations outside of the normal range of human experience. You hear a lot about this, and unfortunately, many individuals who are in the military end up suffering post-traumatic stress disorder just from the things that they experience in battle and combat. So many times, people that suffer from this, they basically end up getting overwhelmed by an event or series of events to such great lengths that they try to look to avoid the situations. Many times people will replay traumatic experiences, and it'll cause a lot of recurrent or intrusive thoughts that could come about. So these experiences, really have a major impact on their lifestyle, because it'll cause people to have to possibly avoid, basic situations in life that, wouldn't be an issue for people that don't suffer from this. Without intervention, post-traumatic stress can actually develop and cause a lot of different physical, emotional, social difficulties for years to come. So it is definitely something that needs to be treated. And again, many times people will end up replaying a lot of the negative events that they've experienced in their heads, and it can become a really difficult thing for them to get treated with. At certain times, they can even compartmentalize, and it leads to an inability to recall important aspects of the events that actually produce the stress that they're having difficulty with. So early intervention for this is extremely important. Obsessive-Compulsive Disorder. So this is when you have persistent thoughts, impulses, or images about exaggerated or imaginary circumstances. And what ends up happening is, in conjunction with that, individuals end up developing compulsive or repetitive behaviors. So you have these thoughts, and they become very intrusive, and they're inappropriate to the situation, and then they end up developing these compulsive, repetitive behaviors. So for instance, I mentioned this one in class, the repetitive locking and locking of their main entryway to their home is one example of that. And many times the focus, the common manifestations of this, the common focuses are either on contamination, doubts, loss of order, horrible trauma, and sexuality are all things that tend to become related to the compulsive disorder, the compulsive behaviors that individuals will go through with this. So here's just a table just kind of showing the common compulsive thoughts and behaviors associated with obsessive-compulsive disorder. So again, the obsessive worrisome thoughts, and then you have the compulsive behaviors that are kind of affiliated with the thoughts that they're having. So for instance, the excessive worry about infections, and you have individuals who repetitively and excessively wash their hands. Is just one example. So the table just kind of shows these up here. So again, make notes of the different behaviors as you see on this table here, and this table is also in your textbook. Okay, so now we move on to the mood disorders. So again, fluctuations in mood are kind of a normal thing in a person's everyday life. However, once symptoms become persistent, it gets to be important to look at what would basically be the cause of it, and when do mood disorders need to be treated. So when we look at depression, so depression can become to the point and so severe where people develop psychotic symptoms. So you could see a lot of changes in an individual's physical, mental, emotional, relational, or spiritual well-being. So again, you look at the difference between getting depressed maybe because something just bad recently has happened in your life versus the person who experiences long-term depression and has it affect different areas of your life. That's where it becomes important to be able to recognize clinical symptoms as they develop, and also note, not only the degrees, but whether it can be situational or global, meaning is it situational from the standpoint that, there are maybe certain things that bring out the depression symptoms, or is it something a little bit more widespread? So kind of as you're going through the reading under mood disorders, make notes of some of the different triggers, if you will, that can be involved in the clinical recognition of depression. So you have, when you look at stressors, and these are sometimes things that can lead to depression in athletes. So again, because in our clinical environment, we're obviously many times working with competitive athletes, it's important to be able to recognize some things that could be the cause of, could be stressors that could cause individuals to be depressed. So you have situational and developmental stressors. Now what we have on the screen here are examples of situational stressors. Okay, so the ones that are up here are all situational. So not meeting performance expectations or self or others, change in playing status, death or serious illness in a family member, a relationship breakup would also be an example of a situational. So those are all situational stressors. Then you have developmental stressors, and these involve like major life transitions. So moving or changing schools, maybe the birth of a baby in a family. Those would be developmental stressors. So those involve things in life, just major changes in life. and they possibly cause a disruption for the individual to the point where they possibly suffer a depression episode. So these are some red flags for depression. So depressed mood, diminished interest in usual activities, irritability or anger, diminished performance. Substance abuse many times gets to be associated with depression, social withdrawal or isolation. Preoccupation with escape or death is another one. So again, as you're going through your reading, note some of the clinical criteria for being able to see whether someone has depression. And again, some of these red flags are involved with that. Note the time frames that they have to experience it. There's also some other conditions that are categories of mood disorders within depression that you have. For instance, you have seasonal affective disorder. So seasonal affective disorder is tied to exposures and changing amounts of light. So literally with the change in the seasons and in areas where, the daylight, the amount of daylight obviously has a significant impact on them. And that becomes very important basically because of the hormone serotonin due to the changing in the light that causes different amounts of that hormone to be produced. So read up on that, and also note some of the issues associated with bipolar disorder. So these aren't conditions that kind of get separated like we classically have on the outline, but kind of make sure that you're paying attention to those through your reading about these different conditions. Anorexia nervosa. So now we're getting into the eating disorders. So we're basically going to look at three of the probably the more prevalent eating disorders. So anorexia nervosa is a life-threatening condition with very high long-term mortality rates. And the part of the classic diagnostic criteria for this is refusal to maintain body weight at a minimum of 85% of an ideal body weight. So this is a person with a severely disturbed perception of their body weight or body image. They have an intense fear of gaining weight or being fat. Overtraining. For an individual who is active, a competitive athlete, overtraining is a very common compensatory behavior. So the individual will eat very low calories and tend to overtrain and work out an excessive amount. So that's some of the things associated with anorexia nervosa. There's a lot of health problems that get associated with this. So note all of the different possible physical consequences of this. And these range from gastrointestinal symptoms to, in the case of a female, irregularities with her menstrual cycle. These are all things associated with it. And again, that'll be talked about in your reading. So make sure that you go through that and make note of some of the different types. There tend to be two subtypes of anorexic. There's the restricting type and the binge eating purging type. So anorexia nervosa can present itself as a binge eating purging type. So that's something that could be it's not just the starvation or restriction eating type that comes about. There's different compensatory behaviors associated with this. Bulimia is a little more common than anorexia, and it can also be life-threatening. So the characteristics of someone with bulimia is binge eating followed by inappropriate compensatory act to prevent weight gain and, again, combat a sense of being out of control. So the compensatory acts include restricting food. The more common one that everyone classically thinks about is vomiting. So people always think of binge purge cycles with bulimia. But remember, that could occur with anorexia too. So it's important to be able to distinguish differences between anorexia and bulimia, because people who have anorexia can also do binge eating and purging, and people who have bulimia can also do food restrictions. So it's important to be able to note the diagnostic qualities between the two, because they are two different conditions. But we have to get beyond just only thinking that it's only the stereotype with bulimia where it's just the binge eating and purging. So make sure you're able to separate the diagnostic criteria between bulimia and anorexia, and there's clinical tips in your textbook for each one that kind of separate how you would diagnose one versus the other. So it's really important to be able to separate those. Also, again, note the physical issues that could come about as a result of bulimia. Some of them are very similar to anorexia, but make sure that you can talk about and list those as well. Binge eating disorder is actually, this is a third category that's recently been added to the diagnostics involving eating disorders. So binge eating disorder is actually the most common one, and what you have with binge eating disorder is eating binges that result in emotional or physical discomfort. So this is a person who basically, more or less, whatever their psychological issues, they kind of more or less try to treat it by eating, and eating to the point where they have a lot of discomfort from the major eating, and this results in a lot of other health issues. So in looking at the different eating disorders, again, one, make sure you look at the important clinical diagnostic criteria, and again, also focus on the treatments associated with this, as you would with all the others. So look at what type of counseling areas, if there are any meds that will get utilized for these or any of the conditions that we've talked about so far. Make sure you're paying attention to those as you're going through, doing your case study and doing your reading. Substance use and dependence, so now it takes us into looking at this. So the use of mind or mood altering substances, and this could take many forms, and we'll kind of define use, misuse, and abuse and dependence. We'll talk about what each one of those means. Again, the social messaging around drug and alcohol use does sometimes conflict and exacerbate problems. Again, it is legal for individuals of 18 to 21, depending on state laws, to be able to use certain substances. There's peer pressure, and many times individuals who suffer from either from substance use and dependence, oftentimes they have denial as a complicating factor too, so they don't really look at what they do as being problematic in their life. So, and the other thing that's going to get talked about here are, again, just some of the different types of substances that could get misused. So, again, as you're going through and looking at some of this in your textbook, make note of some of the different things and some of the issues associated with them. So you have alcohol, you have illegal street drugs, you have other substances. So by other substances, meaning things we don't even necessarily think of as drugs, just inhalants like glue, gasoline, are all things that sometimes do get utilized for intoxicating effects. Even just thinking about like over-the-counter substances that are legal to buy, the misuse and abuse of those as well. So if you think of like over-the-counter sleep aids, stimulants are all things that need to be considered, the issues associated with them. So obviously there's a lot that surround the narcotic painkillers. So as you're going through and reading this, make note of the different types of things that individuals do use and abuse, what they fall under. So for instance, look at the narcotic painkillers, look at the sedatives and tranquilizers, be able to recognize the names of all of those and kind of what categories they fit in as you're kind of going through and looking at your reading. So just to define use, misuse, and abuse. So use is using the substance without meaningful impairment. So this is just an individual who uses something, it doesn't impair. Misuse is the occasional use of a substance to excess, resulting in impairment of one's ability to function. So this kind of now starts to take it to kind of another level when you're looking at utilizing a substance, and basically many times individual will do this in response to something in life as a way to kind of combat stress, which again is not a functional way to do that, obviously. And then you have abuse. So abuse is a maladaptive pattern of a substance that occurs within a 12-month period. And again, what will happen here now is you'll get major impairment in social or occupational functioning. So this will impact an individual's relationship with others. It'll impact their work, and then they will continue this pattern despite ongoing negative consequences. So I talked at the beginning about this, kind of looking at how individuals will oftentimes be in denial with these issues, and that's a common thing at this that will cause them to continue these bad patterns of behavior. So, and again, look at, as I had said, be able to recognize the names of particularly some of the substances. You're in the reading, they do talk about some of them, so be able to kind of recognize those different substances. Then you have dependence or addiction. So dependence or addiction is a maladaptive pattern that leads to significant impairment or distress, and this will get further characterized by either tolerance or withdrawal. So when someone develops tolerance to a drug, that basically means they need to take more of the drug to get its desired effect. Okay, so it causes increased use of the drug so that they can actually get more of an effect for it. So you need to take more of it. Withdrawal is an issue that people experience when they no longer take the drug. So, and that basically signifies a physical dependence on the drug. So when someone develops a physical dependence to the drug, they actually will go through withdrawal symptoms associated once they stop using it. So with certain drugs, in order to detoxify from them, they actually have to go through, an actual medical intervention, because sometimes the withdrawal can be so severe that it could actually possibly kill them. So it's important to note that this is something that could happen with these individuals. Also note some of the comorbid conditions associated with substance abuse. So your book lists some of the different issues associated with that. They also talk about in your textbook the CAGE inventory. So CAGE, C-A-G-E. C, have you ever tried to cut down on your substance use? A, have you ever felt angry or annoyed when someone asks or confronts you about your substance use? G, have you ever felt guilty about your substance use? And E, have you ever used an eye opener, basically meaning using the substance first thing in the morning? So what that basically is a simple set of screening questions that you could ask for someone who potentially is in a pattern of substance use and abuse with an individual. So note that, again, be able to just recognize the names of some of the substances that your textbook talks about. They do mention some, and be able to recognize the categories that they fall under. Attention Deficit Hyperactivity Disorder, or ADHD. This is a neurobehavioral condition that impairs a person's ability to sustain attention or to control activity and impulses in at least two settings, such as home and at school or at work. There's several forms of this. There's the primarily hyperactive, the primarily inattentive, or the mixed. So kind of note some of the characteristics associated with each one of those. Also note the kind of outward manifestations. So in other words, note what typically comes about with the hyperactivity and impulsivity associated with this, and note some of the inattention disorders that an individual has. There's specific diagnostic criteria for this. So, to be diagnosed with this, an individual must have for at least 6 months experienced inattention, including many other issues. So kind of make note of those. Those are listed in your textbook. So kind of take a look at those, because those will be important to know. It's also important to note that there's a high level of comorbidity among individuals with ADHD to have substance abuse, mood and anxiety disorders, and other mental health problems. So many times other mental health problems can be associated with ADHD. And again, also note the treatment, and typically for this, there's various medications and different types of counseling that many times can be associated with this. Make sure to make note of those as well. So as I had mentioned at the beginning of this in class, a lot of times there's stigmas associated with a lot of psychological conditions, and that also includes a lot of times difficulty getting the person to the point where they're getting good treatment. So looking at this, you have to be able to routinely be able to screen troubled athletes. So I had really mentioned a big part of this is being able to recognize a lot of the early signs and symptoms associated with these conditions, and also be able to assess the patient's readiness or ability to recognize that a problem exists. And sometimes that's one of the biggest roles you're going to have to undertake. And many times people in need of change can be one of 5 different stages. So there's stages of readiness many times associated with these disorders. So we're going to go through those really quick to kind of conclude and wrap up. But again, as you go through those other conditions, as you're doing your case study and kind of doing your other study and review, make sure to note any of the other kind of hallmark things associated with the conditions that maybe I didn't talk about in detail here, but that are still important to be able to recognize, even some of the subtypes of the conditions. So I had mentioned, for instance, when we were talking about depression, some of the other subtypes of conditions, as your textbook kind of talks about it. Please make sure to pay attention to those as well. So these are the 5 stages of readiness. You have the pre-contemplation phase, or stage rather, where the athlete has not yet considered that there is a problem. So the pre-contemplation stage is the point where the person kind of needs to be educated on why the things they're experiencing can become an issue. So you need to be able to educate them and encourage them to consider the presence of a problem. So at this point, there still may even be a little bit of denial associated with that. So it would be important to kind of let them know what they could be experiencing, and not only what they could be experiencing, but some of the negative effects of that. You have the contemplation stage, where now the athlete has begun to think about the problem and has wondered whether it's time to change or stop, or for instance, stop using a substance or to seek medical treatment. So this should be encouraged, and an athletic trainer can allow the individual to look honestly at the impact of their condition. So again, there's a role here to play for the athletic trainer. Then you have the preparation stage. So once the athlete has decided to change or seek help, now it needs to be a plan. Again, you could be involved in the process of just coming up with a plan for change. The action stage is when the individual has begun making different changes, so behavioral, situational, attitudinal changes. And this includes at the point where they're actually seeking help. And this is where the referral process becomes a very important part of treating the individual with the problem. And then there's the follow-up or the relapse prevention stage. So this involves the continued implementation or changes to the plan, even despite possible setbacks. So the athletic trainer can use contacts with the athletes on the field or in the office to support decision-making process, and it's important to be able to recognize and possibly confront relapses that could come about, because many times, even despite successful treatment, everybody can experience setbacks, and that's where it's important to be able to recognize those and get them treated effectively. Another thing, given the work environment, what to do in case of a crisis. So being able to identify factors for increased risk of possibly a major issue that could come about as a result of a psychological stressor. So here we have some identifying factors for increased risk of possible problems, and this could be risk for the athlete or for other individuals. So inconsolable emotions, drastic change in typical behavior, use of alcohol or drugs, suicidal or homicidal ideation, threats, or plans, and even a history of suicidal or homicidal ideation as well. So, even during good times, athletes can become overwhelmed by different things, and you can have acute stressors that kind of set maybe a pre-existing problem with depression or anxiety, and could kind of set that off. So be able to make sure that, as a healthcare provider, that you're able to kind of help diffuse the crisis, or in an acute situation, be able to help the individual with follow-up. So again, make sure you're able to kind of look through that. Again, the goal is to get the person for help as soon as you can. So note some of the important practices for this. There's some things that your textbook kind of wraps up with as far as what to do in time of a crisis. So be able to just look at that. It's just, if you're able to kind of know these basic steps with this, it could kind of help making a very highly stressful situation, and can kind of get the individual to the individual the help that they need if a crisis ever develops. So just kind of make note of those different things to kind of conclude the reading in the text. So those are the psychological conditions. Again, note some of the other details as far as some of the important characteristics of the individual conditions, along with their treatments as well.